My name is Michael Cummings, work with BlazePod. It's one of their ambassadors and master trainers, and I have the awesome opportunity to host these webinars, which I get super excited about. So one of the things I wanted to let you guys know is you'll all be getting an email afterward with contact information on how to reach Kevin and George, or Dr. Wilk and Dr. Davies. So we'll send that out afterward, which so we don't have to worry about that. As far as questions go, if you want to ask questions, I'm going to be the guy that looks at those questions and will interrupt these fine gentlemen to ask them the questions, because we really want this to be interactive. These guys are professors, speakers, educators, and that really just here to help answer those questions. I'm sure all of you know. If you do not, we have Dr. Physical Therapy here, Dr. Kevin Wilk, and he's currently the clinical director of Champion Sports Medicine. He's out there in Birmingham, Alabama, and man, the bio is long. Just Google that name and you'll see. I don't want to get too far into it, but we're super grateful that you're here, Kevin. So appreciate what you do for BlazePod, and moreover how you use it as a tool to help ameliorate injury and get people feeling better. And we also have oh, sorry about that.
Oh, that's okay. Pleasure to be with you.
Awesome. We also have Dr. George Davies with us. He right now, well, I guess for the last, lots of years, he's the professor of physical therapy over at Southern Georgia University, where he's running the program, the PT program in Savannah, Georgia. So again, any information on him, go ahead and Google that name, because there is a laundry list of accomplishments that he has had and made in this realm. And it was kind of a dream of mine to be able to get him and Kevin together, because having dinner with George and just understanding and meeting with him a couple times, everything that he's doing as far as research projects and validating certain things, modalities in the field have just been incredible. And so, George, we're super grateful that you're here joining us as well.
Thank you.
And
thanks for the kind invitation.
One of the cool things is I've been to the APTA shows and a lot of the other physical therapy shows, and they all know the both of you, and it speaks volumes. And not just working with BlazePod and not just a social media presence, but to be in this field for such a long time, helping athletes and Gen Pop and just everybody feel better is truly like it's such an awesome calling. I think the reason that everybody who is a physical therapist got into it. And so, yeah, really it speaks volumes on the two of you and what you guys have, the legacy that you've created and will leave in this space. The quick run of show, in about 30 seconds, I'm going to turn the time over to Dr. George Davies, and he's going to run us through a bit of research on how he looks at specific body parts that we're going to focus on today. And then he'll turn the time over to Kevin to kind of show us the application, the applied version of that. So without further ado, I want to appreciate everyone for being on. Please ask questions right there. Click on that little button, ask us a question, and I will get them your information, or I'll ask that question for you. But George, I'm going to turn the time over to you right now.
Okay, thank you. Can you see my presentation?
It's coming up. I want to make one comment. Make sure that you're asking questions and not raising hands. No questions. We're not going to take any verbal questions right now. So just ask the questions. Thank you.
Screen okay?
Yes, sir.
All right. Once again, on behalf of Kevin and myself, we'd like to thank BlazePods for the kind invitation. I would also like to personally thank Kevin for his willingness to participate. It's always an honor and a privilege to do programs with Kevin. I am George Davies, professor at Georgia Southern University in Savannah, Georgia. And my task is to initially just start it off and talk a little bit more about the testing first. And particularly, we've recently completed some reliability testing of the BlazePods for the upper extremity neuro-cognitive reactive testing for both the closed chain and open chain positions. So we've had an interest in this for quite some time. And as you can see, Kevin and I have done several studies together, and this is one where Kevin was a senior author that we published on criteria for return to sport. And then again, just recently, literally within the last couple of weeks, we just published this article on IJSPT. And again, just shows the willingness of Kevin and I to work together to really promote more research. Brian Riemann, who's one of the researchers at the university where I work, also contributed. But at any rate, what we're going to do is talk about, again, as I said, the reliability. And we've had several other projects in the works. This study, again, neurocognitive testing for the upper extremity and looking at some other criteria for return is also in review at the present time. Now, again, to put everything in perspective, this is a very commonly cited study, the 2022 Berne Consensus on Shoulder Injury Prevention and Return to Sport. What they did is they came up with a variety of different test protocols for different sporting activities. What is interesting is the lead author on that article indicates there's lack of quality evidence and an absence of quality evidence with no single test or battery of tests, which is really the best to provide ecological validity, meaning that we don't really have any specific tests that really replicate some of the activities that are going on in sporting activities. As a matter of fact, there's 23 tests that are described in that particular article. And what's interesting, all of those are predetermined, proactive, volitional muscle activation tests in a controlled manner. None of them are reactive multitask tests that simulate the reactive responses that are required in sporting activities. If we look at the Berne Consensus on return to sport, again, they talk about return to participation, return to sport, and return to performance. But over here on the side, which some people have missed, it's again, we need to use open skills and reactive requirements. So is that really this whole idea of this neurocognitive reactive multitask testing? Is that what we're missing in our testing and criteria for return to sport? So with that as a backdrop, we know in the shoulder, we know it well in the knees over the last decade, but we now are realizing in the shoulder as well that when you injure the shoulder, it's also a brain injury. Consequently, we have to test the brain. So that segues into really what I'm going to focus on in the next few minutes is just talking about some of the reliability testing that we've done. These studies were just presented at our APTA national meeting in San Diego a few months ago. So we did one on the open kinetic chain testing and one on closed kinetic chain testing. The purpose of the studies were to establish the reliability of the neurocognitive testing of the upper extremity using the BlazePods. Again, our hypotheses were that there would be moderate to high reliability for both of those testing situations. So we had IRB approval from the university, and we divided them into, again, the closed kinetic chain or the collision contact sporting group. And then the second area we'll talk about briefly will be the open kinetic chain or the overhead sporting activities. So again, and I'm not going to belabor all the details, but we had the subjects do warm up, randomize the testing. They had orientation sessions, and then we had them do the testing, test, retest trials. And then we did, again, ICCs for statistical analysis. So again, if we look at the actual testing, this is the traditional closed kinetic chain upper extremity stability test. The reason I'm starting with this simple test has more references than any other in the literature. But now, again, here's how we turn it into the neurocognitive part, where they do the reactive, where they touch the BlazePods, and they basically do that from the standpoint of having the neurocognitive reactive. we do it with a single light response, and we did it with multiple light responses. And again, to summarize it, we found the ICCs were between moderate to almost perfect in agreement. The actual number of touches, the ICCs, and the MDCs are all listed. Now, likewise, for the overhead sport using an open kinetic chain position, we use the ASH format. So again, the overhead flexion position, scaption, abduction on the side, and then we also did a 90-90 position. And again, that was to replicate some of the positions that the ASH test has demonstrated. So there's the positions on the wall for the open kinetic chain testing. And again, the same thing, the patients or the subjects had an orientation, randomized, then test, retest, repeatability. And as an example, here's just demonstrating the individual doing, again, single light responses. And we do one arm at a time, so dominant or non-dominant, or obviously if it's a patient, we would do the uninvolved side first and then the involved side. Now, after we do single light, then again, the next thing we would do is progress to multiple lights. So here again, the person is being distracted by multiple lights going on simultaneously, and the subject has to pick out this specific light that we're using as the model, in this case, blue. Now, from there, we go into, again, alternating arm reactions with a single light response. So here, again, he's going to alternate the arms with one light at a time. And then again, to make it more distracting, now, as you'll see, we're now going to have all the lights coming on for further distraction, trying to somewhat simulate a sporting event. Because when you're against an opponent, you're looking at the jersey or the color or whatever, and you have to respond to the subject. So at any rate, there's an example of how we did the, again, multitask with multiple lights, neuro-cognitive reactive testing. One more time, whenever you start with a new type of test, again, we have to establish reliability. One more time, again, all the results were between moderate to almost perfect for ICCs. You can see the number of touches, the ICCs, and the actual MDCs that were elicited. So therefore, in conclusion, the purpose of the original studies were to establish reliability of the BlazePods for open and closed kinetic chain neurocognitive testing. They supported our original hypotheses that there was moderate to high reliability for those. And again, we know there's a need for neurocognitive reactive multitask reactive testing, and this study has essentially established the ecological validity. Furthermore, it's the first study to establish the reliability of this type of testing, which is a need because I think it's still one of the missing links. Clinical implications, because we did find good reliability, performing the neurocognitive reactive testing with the BlazePods with the closed and open chain. Therefore, we can use that for criterion-based assessment for rehab, as well as progression for criteria for return to sport. So once again, I would like to thank you. And now I'm going to turn it over to Kevin. And here's Kevin.
That's awesome. Share screen.
George has got to give it up.
George, that was fantastic, as always. Thanks so much for that intro and great information as you've always done as far as data collection and showing us the way as far as some of these tests and things of that nature. I'm going to try to share my screen. George, did you close out your screen?
I did.
Okay.
It should be off.
All right, there you go.
You okay?
Yep.
There we go.
You see it fine, I hope?
Yes, sir. Looking
Good.
good.
So I'm going to take the ball and run with it as George set it up very, very nicely. We've collaborated for quite a few years on things and so forth. So really appreciate everything he's taught me through the years, to say the least. One of the first courses I went to was a George Davies course. So I'm a lot younger than George, but he's taught me a lot through the years, to say the least. So my task is really to discuss the application. I'm going to talk about upper extremity, a little bit of lower extremity. We probably use more lower extremity with the BlazePods. Ironically, I was just thinking about that, but some of the studies that we've done recently are somewhat unique and so forth, and exercises with the upper extremity. So this is where I'm at in Birmingham, Alabama. The upper left is our medical building that I'm in right now. So it's lunchtime here. Also work at ASMI, our American Sports Medicine Institute, which is our biomechanics lab and also education. So proud to be part of ASMI as well. So if you want information on things, asmi.org is a great site as well. So as I mentioned, I'm going to talk about upper extremity application and talk about the rationale why we use neuro-cognitive. I think George did a great job with that already. Some of the specific drills, if you will, and also talk about a few of the objective tests for the upper extremity. And I know we only have, it's an hour webinar. We probably do this for 3 hours, but I'm going to show a variety of examples. As George showed, this is where we started a while back, using BlazePods on the wall. As you see here, there's a gentleman who's looking for the target with distraction colors. We've tried to mount them on different surfaces, as you probably all did through these learning curves. And then BlazePod was so great to come up with the reactive intelligence wall. And that's what you're seeing here. This is a football player rehabbing a shoulder that's unstable, and he's basically looking at target colors, and we'll show a variety of these types of activities. Here, the same individual a little bit later in his rehab, I'm throwing a ball to him. He's got to locate the target, tap it, turn back around. So obviously we don't throw the ball right to him each time. It's to the sides, low, high, and just try to get him moving and dynamics. George mentioned we want to be reactive, and that's the best part of BlazePods is it's reactive, it's interactive, it's adaptable, and it's also very engaging.
Yeah, get it going, get it going.
Here's a basketball player who's dribbling.
Blazer,
the
baby,
red light, he's
Blazer.
dribbling with his
Deja
right
vu.
hand. When it's blue, he dribbles with his left. When it's green, he crosses
Get it
over.
going, get it going. Yes. Yeah, get it going, get it going.
This is one movement that we started, and we've done some testing with George as well. And this is Zach Thomas, who was a PT fellow of mine a while back. And Zach is throwing a 2-pound ball up against the wall. A predetermined number of reps will do a stabilization. And at the same time, he has to locate, again, a target color, in this case, blue, ignore the distracting colors, but the whole time dribble the ball in a throwing motion and have end range stabilization. So we're trying to bombard his central nervous system all at the same time. This is a drill we like a lot for endurance. This is ball drops, it's called. That's a 2-pound ball. We have a sustained hold on the opposite side. And what he's doing is he's on the stability ball. So he's got to really engage his posterior chain, core of his body, and scapular posterior shoulder. So he's actually dropping and catching that ball. And then I'll say to him, hold. He's got to hold that static position. He locates the target colors again, and got a lot going on all at the same time. Tough exercise. And we'll do this for time. So this would be a 30-second bout. So it really gets your shoulder going. And the other nice thing about this is many times we do it at the end of their treatment so that there's a fatigue aspect to it. And we're training that neuro-cognitive after fatigue. As you well know, many of these individuals have injuries when they're fatigued, their mechanics break down. So we're trying to emphasize the endurance component. George, I know you're big on the fatigue and testing after fatigue and things of that nature. Have you looked at that much in the lab?
Yes, we've actually completed a study on that we're in the process of trying to write up right now. And we basically did traditional closed chain test and the traditional seated shot put test. Then we fatigued individuals. Then we repeated the tests. And obviously, as expected, they're all going to decrease. But my question was, what's the normal decrement that normally happens? So as an example, if I have a patient and we test them fresh, fatigue them, test them when they're fatigued, if they're within the normal limits of the fatigue drop, to me, that patient has done a good job with physical rehab for endurance and physical work capacity. I will discharge that patient. However, if we test a patient fresh, then we basically fatigue them and retest them. If they drop by more than the MDCs, or the minimal detectable changes, then that's a patient that I think does not have the good physical work capacity or the endurance. And we've been able to establish what some of those MDCs are. So what you just said, Kevin, I think there's a lot of research, particularly more, I think, in the upper extremity, that shows the effects of fatigue and how it affects shoulder and elbow injuries. And we need to look at that. And I like the idea, as you're indicating, of combining not only the reactive responses, but the reactive responses in the fatigue state. And I think that basically is probably the key to a lot of what we really need to all lead toward. So great job. Great
No, I
job.
agree with you. And we've done some studies. Our biomechanical people, Dr. Fleisig, Dr. Rafael Escamilla, have gone and looked at throwers in particular, and saw that mechanics change once you get later in the game when you're a pitcher. Speaking of that, here's a young man who is a baseball player, a little leaguer, and he's doing some throws up against the wall. He had little leaguer shoulder, as a matter of fact. That's what we were treating him for, a apophysitis. And he's doing his throws, and we want to start this very early. And the cool part about this too, using BlazePod, is the first thing that happens after he gets done is, well, how many targets did I hit? What's the record? What did I get last time? I mean, it's engaging, and it's contagious in a way that people love it. And it kind of breaks the mold of kind of the traditional exercise, if you will. We still do the tradition, but we also bring this into the element as well. We also try to make it fun. Here's two different
Pick up the pace.
The one in the blue shirt is a baseball player. The one in the red shirt is a football player. And they're competing, and they have to hit their target. The guy in red hits the red. The guy in the blue hits the blue. The guy in the red's making a lot of noise too when he's doing it. But I mean, these are just two different colors, no distracting colors other than the targets. And we're looking at who gets the greatest target hits. But at the same time, I'm looking at how do they stabilize? How do they move? Are they breaking down? What's the core of their body? They're basically in a plank now for 30 seconds doing that activity. And you can see it's compelling. Even this guy's sitting here, and he's just locked in, wants to see what goes on. And he's up next.
They're great motivators.
Absolutely.
We always talk about the concept of functional rehab. Don't lose sight of the first three letters. If the patients aren't having fun, then it's not going to be a very effective treatment session. So that's one of the things with the BlazePods, is not only does it affect the neuro-cognitive reaction, but the subjects and the patients that are doing it are having fun at the same time. And I think that's a key element.
Totally agree with you. And I think that's how you retain people. That's how they finish their rehab, and you take them to the level that you think is necessary. So many times in the past, before, quite honestly and quite directly, before we started using BlazePods, I'd have patients who kind of burn out. You know what I mean? They kind of burn out of the rehab. Even though I'm trying to change things up, I'm not quite sure it was as exciting as it is now. And it's engaging, rewarding. Each time you get done with a task, like with some of these that I'm showing, you get a score, and you know exactly where you were in comparison to the other. It's really changed my practice. And I'm not just saying that because this is a BlazePod webinar. I'm being very, very direct and very, very honest about that. We know after a shoulder injury, like you see here, this person making a tackle and he dislocates his shoulder. We know multiple things happen when somebody dislocates their shoulder. It's not just one structure. Same thing here. This young lady reaches in and dislocates her shoulder pops out. Basketball player, which unfortunately we see quite frequently, and certainly happens in other sports like lacrosse and soccer and you name it, any sports for that matter. But we've learned that it's not just the capsule that's torn, like with a Bankart lesion. There could be bony changes that occur recurrence, like a Hill-Sachs lesion, or even glenoid types of problems, as you see here. But interestingly, and Dr. Leppard showed this years ago, that there is a proprioceptive deficit as a result. And several people have studied that in the past. Matter of fact, Dr. Leppard won a research award documenting that, won the NEAR award that particular year when he looked at after a dislocation, people's proprioception was altered. Since then, there's been studies looking at what's going on at the brain level, using MRI brain scans and looking at what's happened with the shoulder in particular, just like some of the great work that's been done at the knee with Dr. Grooms from Ohio University as well. But we found out that at the shoulder, the same effects occur. And it's interesting looking at some of these brain scans with either voluntary movement or passive movement, you're recruiting different areas of the brain when there is a deficit. And what's interesting about this particular study, they looked at individuals who had recurrent shoulder instability and the significance of that. And we all know that people who have injured their shoulder, many of these individuals try to make it without surgery, and they have repeated dislocations. And you wonder why the dislocations get easier. Is it just all structure, or is it a question of losing that ability to stabilize, knowing where your joint is in space, but also being able to react effectively? And I think some people do well and some people don't. George, what's your thoughts on studies like this? I know you've looked at these extensively.
No, I agree that in the past, we always thought of the injury as being the peripheral injury to the proprioceptors, the mechanoreceptors in the shoulder joint. Now, and basically we've learned from the knee and Dr. Grooms's work that it also has that effects on the central nervous system in the brain. And I think that's where our rehab is ultimately heading. That there's even some recent research, did a presentation at a recent course on advances, and different parts of the brain are affected based on different types of injuries. And I think ultimately, as Kevin just pointed out, that if we're using passive motions or active movements, that we can actually facilitate the reorganization, if you will, or the facilitation of specific parts of the brain. Recent research even showed that, there's certain areas that affects just the cerebellum. There's others that affect the motor cortex. And I think ultimately, I'm going to say specialized medicine and specialized rehab is going to start targeting specific exercises that actually recruit that part of the brain. I think that's where we're heading. That to me is going to be the individualized type of medicine.
Totally agree. And I think we'll get to the point in time where we'll actually be able to just wear a skull cap and actually do our own brain scans with these movements. We're close. There are a couple devices out there. It's very costly right now, but I think in time it will get better. But certainly this is the direction, and certainly like systems like the BlazePods allow you to target this and train those particular areas that these people are having neuroadaptations. And some of those adaptations are good, and some of those adaptations aren't so good. A while back, fortunate enough to write a paper with George Davies and Mike Bagwell and Chris Arrigo, where we looked at how do we test shoulders, not only in the literature from the previous standpoint, but also what are we doing at this particular time, which was a couple of years ago, what are we doing right now? Now, what's interesting about that paper, that's in the International Journal of Sports PT, which is a free access journal. So you can take a look at this article. It was published in 2020. As I mentioned, it's an interesting paper because it does a great job as far as review. But what's interesting is I'm actually already changed the way I test. 3 years later, I do some of the tests, as we'll talk about in a few minutes, but we've also added specific BlazePod tests in particular, which we didn't have in 2019 when we wrote this paper. So let's talk a little bit more about this. Here's a gentleman who actually had elbow surgery to give me how quick we are to do things. And all he's doing is on the table doing some reactive training. And we know that what George has shown years ago, that not only when you're doing something like this from a strengthening standpoint, you have a physiologic overflow to the opposite side, but there's a neurophysiologic effect when you train one side to the other side. And that's what I think George was alluding to. When someone gets injured, let's say a shoulder in this case, or in this gentleman's case, it was an elbow, we've always thought of it as being a peripheral localized effect. but excellent work has been done throughout the country and the world have shown you injure your right elbow, your left elbow is compromised, just like with an ACL on the knee, just like with your shoulder injury. And the reason for that is it's affecting your central nervous system. And so we try to get on this right away. Here's an interesting way of kind of maybe doing some shoulder rehab. We've got somebody on a Bosu ball stabilizing. It's a shoulder patient. One of our trainers, who's very handy, made the stand. And we basically have mounted the BlazePods on the stand. And what he needs to recognize is if it's green, he throws with the left. And when it's red, he throws with the right. And he just alternates back and forth. So he's got to react. And we can do this with different masses. That's a 2-pound ball, but we can go up to 4, 6 pounds. So he's bringing the core of the body into the equation. He also needs to throw, so he's got to react and catch, especially with a shoulder that may have been compromised with instability or subluxation. Gymnasts, we use a lot of closed chain exercises for gymnasts. And so I tend to see a lot of gymnasts. This is an elite gymnast, now on her way to college. At the time, she was a high school. Great plank there, great core control, doing a little bit of step over, as you see here, has to recognize which BlazePod is the target and basically hits it. So she's not instructed just to go side to side, but go in the direction of the target. So it's very reactive. And I think that's really important. And George made that point early on that the tests that he proved that were reliable were all reactive tests. Unanticipated types of movements opposed to anticipated types of movement or tests. And we use other devices too. So I know this is a BlazePod webinar, but just realize we can use other types of apparatus as well. So now we go back to the reactive ball. These are called, let me stop this for a second just so I can kind of set this up. There we go. So these are called hexo sticks. And these are 3-prong little devices with different colors, 3 different colors. So actually what we're doing with this gentleman who literally just left a few minutes ago, we're crisscrossing our throws. So he has got a track. We call the color. He's got a catch with each side. So we might call the color to catch, or we may say not red or something else. So he's got to react to our verbal, and then he's got to turn and hit the target BlazePod. We're combining stimuluses, if you will, from a tracking visual standpoint to a reaction time, shoulder stabilization, and also the ability to move in space. That's tough. That's a tough task.
Yeah.
Throwers. We know that throwers have a lot of mobility, and many times they're challenged as far as controlling that. And we work on strength, and we work on dynamic stabilization, work on scapular control, core of the body, proprioception, all those things. But I think a missing component, as was talked about earlier, is again, training your neuro-cognitive system in these individuals. So here's an exercise we like to do a lot of. 2-pound ball, throw up against the wall, predetermined number of reps, basically stabilize. We may put them on a stability ball, bring the core of the body into the equation a little bit more, sustain hold on the opposite side. Now, what I'm asking him to do, I'll be quiet in a second. I'm asking him to count backwards as he does this.
Go.
30, 23, 16, 9, 2.
So all of a sudden, this particular task becomes a lot more focused. It's always funny when I ask somebody to either recite a color back or color sequence or numbers, how the intensity dramatically changes. Suddenly, it's still, fun. It's still, but it's all of a sudden the concentration and the focus is magnified. George, has that been your experience as well?
Yes. I think by adding, as you said, having them do multitasking simultaneously, I think that brings in so much more of not only the reactive response, but also the cognitive concentration to then have a reactive response simultaneously. And again, the whole purpose of this is to try to mimic to some degree what's happening in sporting activities, because sporting activities are sort of mass chaos, to be very frank, when you look at the different activities. And we can never really replicate in the clinic exactly what they do on the field or the pitch or the court. But nevertheless, the more we can kind of simulate it and train them, I think the better off they're going to be in the transition back to practice, competition, and then performance.
Yeah, totally agree. And they've got to be able to think when they're out there, especially if they're a quarterback or a baseball pitcher like this guy. I mean, they've got so many things going on. How it is when we get distracted sometimes. You get 3 or 4 patients going, they're asking you what's next, and the ability to juggle, you know what I mean? It's the ability, and then they ask you a question like, you remember that player 20 years ago? Who was his name? It's like, oh boy. And the older you get, the little harder it is to remember all that some of you might find out later in life. So try this. Those who are on the webinar, this is a great task to do, is to tap at the same time of these throws. And we really like for them to get that ball going up against the wall, moving pretty quick.
193.
He's counting backwards again. We tend to do a lot of the counting, but I do like reciting colors or sequences of names or anything that you like, just to bring in the brain into that particular aspect.
37. Hold.
Counting down by 7s from 100 while doing this.
Ready? Go.
93.
Reverse.
86.
Switch.
79. 72.
Good. So transitioning from some of the upper extremity stuff, now looking at some things that can be done
Reverse.
lower extremity. But notice also he's got to react to the ball.
Switch.
I don't know, Kevin probably has him counting backwards by 100, by 7s, ethereal 7s, doing different types of drills, and he's calling out different movement patterns that he has to do, react to the ball, counting. So you can see the concentration and the reaction that this guy has. I mean, that's a stud athlete to begin with.
Yeah, and he's a right ACL. And, he's a really good athlete, to say the least. He did really well with his ACL. But even when we do this task, what's interesting is, he did really well. But many times they'll come back like a guy like this and say, hey, let's do it that way. Let's bring in that component. Now, a takeoff of what Dr. Davies showed is the upper extremity stability test that Dr. Davies taught us. That's why the tape is on the ground by his hand. So that's 36 inches apart, as he's alluded to and shown us that particular testing. This is kind of how we started a couple years ago. We started with just a couple BlazePods to the side where they had to go back and forth with the same hand, seeing what kind of stabilization, how they move. And like anything else, as you do things, you start to expand the reaction, make it more complicated. Here he's on a BOSU. This is one of the therapists. This is actually Louis Lipowitz, who's now practicing up in New York, but was a fellow here about 2 years ago. And you can see Louis, he's doing well with it, but it's a major, major challenge compared to this gymnast. So it's interesting how, the demands, she's rock solid on there. She's locked in, core of her body's not moving. We've got it almost like a diamond type shape, which I like a lot. And she has to react. We're really looking a lot at her scapula, posterior chain, and her glenohumeral joint, if it translates posteriorly. Sometimes we can have the person be mobile with it. So here she's planking, elbows to feet, and just basically migrating or moving to the target itself. And, again, what's great is it's so adaptable, it's so flexible, that you can basically do whatever you like to do with the particular BlazePod system. Here, what I've done with this gymnast is I have her hand on a piece of foam. She's got to stabilize, and she also has to tap the targets. She's in a high plank position. That's actually a lot tougher than what it looks. Some of these gymnasts are making it look really, really easy. But by far as the core of the body, I think the gymnasts are some of the best on the planet. Showed these a couple of times, so I'm going to go past this. Now let me go back and just mention this, and I know we want to get into testing.
Right, left,
I have used
Right.
tape like you
Right.
see here on
right,
the ground. We do this
left,
lower extremity as
Left.
well. We
Right.
put tape on the ground. We might number the tape. In this case, she's just doing her hands back and forth, and I'll say right or left. And that's okay. And again, I don't want to make it sound like, this is a BlazePod sales pitch, but the difference between the numbers on tape and the lights are dramatically different. So I've used both, and the problem with just using tape on the ground and thinking you're getting the same effect is you don't get the distraction. You don't get the cognitive discerning colors and so forth, or the configuration. With the numbers, you just locate the number and you go. You're not distracted by anything. Does that make sense? And I know, George, you've tried some other ways of doing neuro-cognitive. What are your feelings about like lights versus tape and numbers and even colors, just Post-its?
Sure. Well, obviously, old school things. We used to use tape before the BlazePods became available. And as you said, you can call the numbers or have them do different reactions to numbers or colors. And I've done that in the past. But as you said, particularly when you have multiple colors going, I think that's one of the better ways to do it. Simulating, once again, back to sport. If you're in a competition, multiple players, different color jerseys or different numbers. And I think that's the value of having multiple distractors versus, say, one thing where you call out a number and they have to react to just a single thing at one time. So I agree. I think the BlazePods has dramatically changed the ability to be effective with some of the neurocognitive reactive training and testing.
Go back to PowerPoint.
I'm going to switch to a different talk here, George. So just
Yeah.
give me 1 second. If you'd like to say a few things more, that'd be great.
Yeah, I think some of the things that we talked about is, again, my mantra is test, don't guess. So even though we're seeing a lot of different types of, I'm going to say, functional activities and the neurocognitive activities, I think we have to, again, always make sure that we have reliable tests that we can use to assess the patient's progress through rehab, and then ultimately to facilitate the clinical decision-making for return back to sport. Other things that I think that we brought up is, again, something that also, in addition to the neurocognitive response that's been overlooked, is number 2, is to think about the contralateral overflow or the cross-education effect. And then thirdly is the endurance or the fatigue factor. I think there are 2 things that we really haven't addressed adequately yet in rehab. So just some things, again, part of the webinar is also not only to answer some questions, but certainly to raise a lot more and get everybody doing more critical thinking so we can all learn and share information from each other.
I want to
Guys-
show, I couldn't agree with you more, George, by the way. I mean, totally spot on. Thanks for a great summarization and also things to think about. I'm going to show a few more things related to the lower extremity. I know the time's flying by. So I'm only going to go for about 5-7 more minutes. That way we've got about 5-10 minutes of time for questions. So I know there's going to be questions. So I definitely want to address that. So, when we talk about the lower extremity, one thing I do want to mention is the article that George and I wrote, American Journal of Sports Medicine, came out earlier this year, where we said there's a need to change the way we test. And, we do T runs and L runs and hop tests, and those are fantastic tests. But am I really going to return someone to play based on a hop test when they have to go out there and react and do anticipated movements? And we know in the world of soccer, the most common way people get hurt is when they're going for a ball and it's kind of this unanticipated type of movement. It's a perturbation, they get jostled and so forth. So the idea of this particular article, which I think, again, I think we did a decent job trying to lay the groundwork, to say the least, is to say, hey, let's do something where we set up like a T run and they're BlazePods, and they can run and tap the BlazePod right when they're ready to make a cut. And then they go to the lateral one, tap it, go to the opposite side, tap it, and then finish the T. And what the BlazePods allow us to do is make it reactive, so they don't know which direction they're going to go in until they get there, until they tap. So that's great. But it also gives us the timing mechanism from one pod to the other. So it's an objective test. Now, it's nice to use a stopwatch and say, well, you did within 11 seconds, but what about from one site or one point to another? So the BlazePods work fantastically. So we've always done some of this perturbation stuff like you see here.
Yes, I like it.
But look at this guy. This guy's a soccer player. He's actually a
Faster.
position right ACL.
You can do this. You're going down,
doing a
Brian.
staggered
You're going
type
down.
of foot fire, and he's tapping the targets at the same time.
Come on, fast.
And I know some of the colors don't show up well on videos because of lighting in the clinic. There's also distraction color. So you do that for 30 seconds or 1 minute straight. That
you got it. Come on.
Tough exercise. We do a lot of this, and this is actually one of the tests that I do in the clinic. BlazePods are set up, distracting colors as well as targets, and he's moving laterally. You've got to catch a ball. You've got to locate the target color, ignore the distraction color, but the whole time maintain good knee stability, speed. And again, the first thing a guy like this is going to ask me, what did I get? He knows his number. That's the other thing I'd say is a person like that who's done it numerous times, well, actually, any people I deal with, they know what they had last time. They know what their personal best is, by the way. And it's interesting to me how motivational it is. Here's that same position. And what Zach and Doc are doing is they're tapping the BlazePod target. So we have two different systems set up. So in this case, we needed two iPads or two phones where we have the app running. And they're both counting backwards, by the way. So Zach is counting one number, so he'll say like 93, and then Doc will do the next number by 7. And they go back and forth counting, but the whole time looking for the target and tapping the target while passing the soccer ball. That's a lot going on. And you as trainers and you as therapists and so forth, that would be engaging for you as well from a cognitive rehab standpoint. 2 soccer balls. So this is only one set of BlazePods here with 4 lights. So we have 2 balls. So the minute one ball gets kicked, the other ball is released. So it's really tough. I mean, they got a lot going on. And we do a lot of this. We do it with throws as well as catches and so forth. There are a lot of BlazePods going, a lot of colors. Only one target color though.
Kevin, I want to interject a question here because it seems apt based on. Oh, look, who is that? He got confused.
Yeah, he got all shook.
One of the questions, and I'll kind of format in my own words, but in these, due to kind of the neurological stress of all of these complexities and open skill drills, how many would you recommend? What's a recommended dosage that's not going to cause, I guess, like too much neurological fatigue or start to be too much for somebody? Do you have any parameters that, talk about, or what's your structure, I guess?
Yeah. So for me, and actually I want to hear what George's comments are as well. For me, when I'm looking at neuro-cognitive as well as neuromuscular control, we look at the movements, we look at fatigue factors, we look at different circumstances, where they're at in their recovery. So for me, I'm in the rehab world, so I look at where they're at in their rehabilitation. If I know that neuro-cognitive is an issue, and what I mean by that is inability to contract, like a quad after an ACL, that's something I start with their rehab. So I do specific training that I hope to get to in a minute, as far as trying to get sensory input. And then they'll do some traditional strengthening and maybe some balance and neuromuscular. And then I always end with neurocognitive. So I start and I finish. Whereas a person like this football player is doing really well and we're just adding on a task, I almost always do it at the end or toward the end when they're fatigued a little bit, because I want to see how they move in a more fatigued state. Because I think, like we talked about earlier, Michael, I think that's when they are most vulnerable. George, what's your thoughts?
I would totally agree. I think it's the qualitative assessment of, as Kevin just said, the movement, particularly in a fatigue state. As I just stated a little while ago, besides the neurocognitive effects, we have to look at this whole concept of contralateral or cross-education overflow and the fatigue factor. And there's very little objective testing, particularly of the upper extremity in a fatigued state. And it's something that we're missing. And there's no testing of neurocognitive testing in a fatigue state of the upper extremity. So there are some things that, again, that we need to deal with in the future.
No, great points. You know, everybody uses, well, not everybody, but a lot of people use the Y balance test, which again is a good test. I don't really have a problem with it other than it's not dynamic enough for me. But I think for a level of looking at dynamic stability and movement. So here we've got it set up like a V, but I've even done Y with it. This makes it more reactive. So she's got to stabilize on that stabilizing side. Meanwhile, tap the lights. Now, again, this doesn't look like much until you have an ACL problem or patellofemoral instability. And it's very challenging. Look at, I mean, she is focused in, by the way. She's locked in on that task. And that's really what you want in rehab, by the way. You want your person locked in, getting the effects of training. And I do want to get to, I'm going to skip over a couple of these. I want to make sure we get to some things that can be done right after injury. So let me skip a couple of these real fast. I'm sorry, I thought I could get to different points. Got a lot of videos, to say the least. So what do we do right after injury? Because people say all these drills are great, but they're really not that I can do after an ACL surgery or things I can't do right after an injury. So what we're doing here is just the timing mechanism. And we all know sometimes these patients just zip through their exercises. So now what we set up is no real neurocognitive other than the timing. We want to make sure they do a sustained contraction, slow on the way down, really emphasizing eccentrics. So now the BlazePod is really used for strengthening, muscle activation and strengthening. Now we added in some distraction colors. So now he can hit the target that lights up. And he has to react. Again, this would be somebody who just got injured, you know, maybe a day or two post-injury, day or two after surgery. Here now what we're doing is combining open kinetic chain knee extension. I love this exercise, by the way. And there's numerous ways of doing it. Here he's just hitting the target color, but what he's doing, if you watch closely, he's hitting blue and he's also hitting red. Red with right, left with blue. And so we tell him he can hit with either side. Now look at this gentleman. You see what he did? Kind of confused. He's an ACL reconstruction. He's 72 years old, super active, skiing, he's a pilot's license. But I'm going to start it over and watch what happens when the lights light up with him. See what I mean? There's a little bit of a sensory type of overload. Now he's starting to get the hang of it. And let me say a couple things about this. We can do different colors. We can tell them, hey, blue is your target, hit with either hand. We can ask them to do a delay, hold up at the top with their leg. We can have them count, talk at the same time. So one thing I like to do with a particular exercise is they do the exercise, they get it down, then we add in more and more complexity as they master it. So we're constantly trying to challenge them along the way. And you know what? He loves it. This guy just got into it. He goes, that way, you know, when I'm in the cockpit, I got a lot going on. I want to get that back because I almost feel like I lost it after the injury because I can't fly. He couldn't fly the plane for several months because, you know, can't get in the cockpit. Private planes, he kind of, you know, it's really tight.
The other thing that's interesting about this is if you notice, and there is some evidence that shows if you have a lower extremity injury and actually train the upper extremity, that there's also a facilitatory type of an effect. Conversely, if you have an upper extremity injury and you train the lower extremity, then there is some limited evidence that shows that, again, there's a positive response. So whether, you know, once again, that can't be a muscular response as much as it's a neurocognitive response. And that just further goes to show the importance of the whole concept of what we're trying to describe now versus even just a few years ago. As Kevin indicated, that article we published in 2020, it almost seems prehistoric to me now when we look at what we do now compared to what we did even just a few years ago, based on what we've been learning and some of the new technology that we have available.
Yeah, I mean, it's just taking off. It's just flying. The technology, the innovation is just unbelievably quick. Let me show 2 more videos, and I've got a ton of them, but I know we're running out of time, and I want to be able to answer any questions.
Yeah,
So the
we got a
ladder
few
drill we
questions and
showed
about 5
before.
minutes left.
So here he's going through the ladder, and he's got to tap the target. No distracting colors, so this is a timing mechanism on the BlazePod that I'm using here. Now I can do distracting colors, and I can do reactive. It's just where he's at in his recovery, it wasn't really appropriate for him to do peak time cutting one side to the other. This is a guy immediately post-op. ACL, as you can see, he's still using a crutch. We like to do stepping over cones because it forces them to bend their knee, spend time on that side that's weight bearing. This guy's NFL player. I mean, doing this, and you can see the level of engagement. All we're trying to do here is get him moving, get him to bend his knee, stabilize on that leg, tap the light, and we can make it reactive as well. So the BlazePods can be used immediately after injury all the way to advanced stage. And I wanted to show some of this because I just don't want people to think that this is all advanced rehab stuff. So here's a gentleman. This will be the last one I'll show because, again, I know we want to have some dialogue. He's 3 days after his ACL. We do this all the time. We'll put a couple of BlazePods around. He's got to stabilize. I'll have him close his eyes at first, and then I'll say, go. He's got to locate the light, tap it, close his eyes again. I'll say, go. He's got to tap the light. We just go back and forth. I don't have a video of it, unfortunately, but I wanted just to show that setup. So, Michael, with that, I know we're running out of time quickly, and I apologize for that, but wish I could show more with the testing. I had a whole talk on that, but time flew by.
That's going to be one of the questions that that our attendees have. This one kind of goes back to what we were talking about earlier with kind of the programming, if I can call it that. Are you performing the BlazePod test weekly? And this is for the BlazePod test weekly, bi-weekly, or monthly in your clinic or in the clinic?
Yeah, for me, I usually space them out a bit. So I don't usually test weekly. I'll test every couple weeks. If we talk, upper extremity, if it's an athlete who has shoulder instability, for instance, like with some of our tests functionally, I will test every week because it's so quick to return them back after an episode. But after surgery, I space them out. If it's a thrower, it's usually a milestone. Can you start throwing? Can you progress off the mound? Can you go to competition or inter squad games? ACLs, it's usually about 3 to 4 weeks. But one thing I will say, and I'll hand it over to George, because every episode I get a score, it's almost like I'm testing them every time anyway. Does that make sense? So I'm getting data every time there is a exposure, which I like a lot because I'm a data guy too.
And the patients remember that, as you said, they know what their last score was, and the next time in, they want to beat it. But again, when you look at testing for muscle strength, there is a study in AJSM by Bowden, and they showed that from a strength standpoint, like doing something like a Biodex test, that you shouldn't test more than usually 6 or 8 weeks to find a really significant change. But again, we're not talking about just strength anymore. We're talking about the neuro-cognitive response. So as Kevin said, essentially almost every time, even though you may not be recording it yourself, those patients know how they've done. So I would say the same thing, that at least every few weeks, you would want to try to use the BlazePods as a test, don't guess, so you know how the patient is progressing.
Also,
Awesome.
my experience has been the neurocognitive gains are much faster than muscle return. It accelerates tremendously quick. And we tell patients that, and they even see that, hey, I'm so much better on my involved side. Many times they call it good leg, bad leg. And it's like, hey, I'm better on my bad leg, when they're balancing and using BlazePods. And I say, that's what I expect out of you. Because you're doing so much, I expect you to be better on your involved side. And stop saying it's bad leg, by the way. Don't use that word.
They're both good legs.
That's right.
In which pathologies could the BlazePod, would you recommend the BlazePods not be used?
Oh, boy.
There isn't one I can think of. I mean, I use it for everything. I use it total hip patients, total knee patients, concussion, yeah, everything.
I guess the only one I could potentially even think of is if a patient had previous seizures. That with the multiple lights, particularly in the open chain fashion or something, could be a factor. I have no idea, though. That's the only thing that comes to mind to me is a
Yeah, that's a
patient
good
that has a
point.
history of seizures.
I've had 2 people here with the strobe glasses that had a seizure as a result, but they've
Oh,
done
wow.
BlazePods and haven't had a problem now. So I
Okay.
think strobing is different.
Yep.
But but I think that's a
Good
great
point.
point, George. Something to think about.
I like that question. So to let everybody know, what I like about BlazePod is a lot of the things that Dr. Wilk and Dr. Davies have talked about, like BlazePod has incorporated in analytics and metrics that you guys could use to further test. So they're constantly changing based on the needs of the quote unquote customer, which I think is pretty cool. Just a couple other questions, and a lot of people who are out there kind of want to, a lot of respect for you guys and kind of want to be in your head a little bit more. And so one of them, a question is, can the DOI of the reference materials please be shared outside of the presentation? The RTP guidelines would be awesome to download and review.
Yeah.
Was
Sure.
one of them.
Yeah, I don't have a problem with that.
Yeah, several of the articles that we cited are in IJSPT, which is an open access journal. So again, you can just put in the last names and then that will show up, and it's open access. So it's free to download the hard copies or e-copies of the articles. It's one of the reasons I think it's important, frankly, to publish in a journal like IJSPT. It's open access and lets everyone have access to the information.
Awesome. There's a couple people who were they didn't like the fast forwarding of those videos because they were just taking them in. And so I guess the question is there a way to rewatch the full presentation? I know that we are going to record this and put it up, but you're pretty famous, and what you guys are doing is pretty awesome and really helping out a lot of PTs out there. We could probably do that, right, Kevin? We can and George get the full presentations and post them on YouTube or through the BlazePod Academy or something like that.
Well, the fast movements were obviously in the terminal phases of rehab, where you're doing quick things like that to make it sport specific.
So it's on Kevin, you guys for not having
about your Instagram.
Yeah, so a lot of the videos I showed are on my Instagram. I mean, there's probably a couple thousand videos total, probably 20, probably more than that, probably 40% are on BlazePods, believe it or not. Matter of fact, I posted something today and yesterday, both were BlazePod type movements, pretty unique. But yeah, Michael, we can make something available like that. I mean, I felt bad. Like I said, I loaded up a lot of videos in the last couple of days. What I feel bad about is we didn't get to the testing, the reactive testing. I tried to describe it, but it's really interesting to see T runs, L runs, and hop tests with the BlazePod. So, maybe we can make those videos available, or, we'll talk about it again in another webinar or something.
Yeah, we'll figure that out. And I
Right.
feel like you guys just volunteered for another webinar in a couple months, so appreciate that. The last one, do you guys have a handout with descriptions on testing protocols for the UEC, CKC and OKC and the ASH test, etc.?
Yeah, those articles, those 2 posters were presented at CSM, and one of them actually was an award-winning poster. Out of the 1,200 posters that were there, one of them became one of the top 10 posters had to go through an additional review process and an interview process. Didn't win the blue ribbon, but it's pretty nice to be recognized as one of the top 10 out of 1,200. But nevertheless, we do have that available, and we're in the process of writing those up. So again, because of copyright, when you basically give the copyright to a journal, you can't distribute everything. But I can share the posters, and that has some relevance. So Michael, you and I can deal with that later.
Okay, cool. Yeah, we'll put it up.
And as far as our upper extremity tests, as far as the setup for BlazePods and also the lower extremity, we do have that written up, and I can make that available. Absolutely.
Some of that's published, Kevin. I think the most recent publications have demonstrated some of that for the lower extremity, the 2020 or the most recent one. And we have the one coming out with Zach with 170, was it, subjects or something like that? And the reliability, well, at any rate, we have some of that stuff coming out.
Awesome. I can't thank you enough. We're at time. Literally hundreds of people stayed on the entire time, which I really haven't seen before. So from me personally, I know Simon personally, Farber, our team, and certainly the extended team BlazePod, really want to thank you guys for just everything you've done. And like for me, I went to PT school and that wasn't in my cards, and so didn't finish it, but I got into it to help people. And by the way you guys present and your demeanor and everyone you're helping, that to me is like, that's awesome. I just want to thank you, and in behalf of all the physical therapists out there too, thank you for what you guys do and helping lead this great industry and this charge, this message. And then from BlazePod, we're so grateful for you guys for everything that you've done to help us spread this cool tool that you guys have really done some amazing things with, that we didn't know that it had that potential. It was created to help burn calories for overweight kids on a playground. and now to see it flourish in the medical field has just been awesome, and that's really thanks to you guys. So I don't want to take any more of your time, and we'll work out some of those question details later, what we post and how we post and share it on the BlazePod Academy. BlazePod Academy is also a resource for all of these webinars and a lot of other research studies that these two gentlemen have done. A lot of things we're posting there. We're currently in process of rebuilding our physical therapy page. And so you guys have given some great sound bites that I know the team will be, utilizing that information to do that. And then as far as the testing goes that you were mentioning, we'll attack that another time. So thank you guys so much for everything. And
thank you for a kind invitation.
Yeah, it was great.
Happy 4th of July. I appreciate you guys.
Yep. Happy 4th of July to all.
Happy 4th, everybody. Stay safe. Enjoy it.
Thanks, Michael, for setting this up.
Thank you.
George, it was great. Thank you so much.
Thanks, Kevin.